This is my windshield survey presentation. My name is Brantley Lannon. I've been a nurse for about 2 years and I work at a hospital. This windshield presentation is for community health nursing. I chose to do my presentation over Linton, Indiana. I've lived here all my life and I currently live here, so that's why I chose Linton, so I could learn a little more about it. Linton is located in Stockton Township, Greene County, Indiana. And according to census.gov, as of July 22nd, the population in Linton was 5,162. Physical characteristics, maintenance of yards and houses. I feel like it depends on what part of town you're at. Like if you're on the south side of the town, there's more houses that are in poor condition. They have poor siding. It looks like they haven't mowed their yards in 4 weeks. A lot of overgrowth yards, and you wonder, did someone live there? And then you go to nicer part, like maybe the north side, and the houses are really nice, or they're brick and they have pretty landscaping and flowers outside. Stray animals. I feel like you see a lot of stray animals in Linton, whether you're driving or you're at your house. But those stray animals are typically skinny. They're usually timid, unfortunately. There's a lot of animal abuse that goes on around our surrounding towns and in Linton. Sometimes you can get those animals to warm up if you're at home and you leave them some food. And we also do see pigs and cows out of fences pretty occasionally here, or pretty often here, I'm sorry. So that's kind of funny to see the town call in so-and-so to see if that's their cow or their pig out of their pasture. Pollution. There are quite a few people in Linton that do have like COPD, asthma, respiratory issues. We are located by a power plant. It's in Miram, and if you go to a certain part of Linton, you can actually see the smoke towers. So I'd say we get quite a bit of air pollution from the smoke, those smokestacks, which is from a power plant. Economic characteristics. Overall, Linton's economic status is poor. We don't have any large industries around Linton, other than the surrounding coal mines, which the surrounding coal mines do provide jobs for a lot of our people in Linton. In 2021, the median household income was $38,179, and we know we need a lot more money in 2024 than what we did in 2021 to survive and provide for our families. Homeless. There are some homeless people. You don't see them sitting around town like you do in the big cities like Indianapolis. Every once in a while you will see someone standing on the corner asking for money, saying they're homeless, but not too often. But there are people that you could consider homeless due to this subpar housing. I just heard of a story about 2 people. They were actually living in a enclosed deck, basically, over the winter that had no insulation. Like, it was just enclosed, and that's what they had to live in. Employment. We do have several opportunities for employment here. They're just not large industries. We have several grocery stores, Walmart, dollar store. We have gas station, restaurants, healthcare facilities, insurance companies, and the city workers. Walmart and Save-A-Lot do accept food stamps, and I know Walmart also accepts WIC. I've worked there before, so I would see that being used by quite a few people. Linton unemployment rate. This is for residents aged 16 and older who are in the labor force, and that unemployment rate was 6.4. And as of February, Indiana's unemployment rate was 3.5. So Linton's unemployment rate is quite a bit higher than Indiana's overall rate. Education. Schools. Our high school was actually rebuilt in 2000. They added a new facility. They added an extra wing for our junior high about 7 years ago. We have a new athletic facility, a new softball field. We have tennis courts at the high school now, and a nice new locker room and concession stand. So I'd say our school's pretty up to date. School nurses, they actually added a nurse after COVID because the school nurses had a lot more to do after that. Typically, the nurses at the school, they're older women. You don't really see new young grad nurses working at our schools. They are required to wear scrubs or a school spirit shirt. Graduation rate. Lytton's graduation rate is 85%. I know back when I was in high school, we only had 87 students graduate. So we're a decent sized school, but not super big. Indiana's graduation rate was 86.69, so Lytton's pretty close to Indiana's rate. Library and services. We do have a library, and it's on the southeast side of town. It's really nice. You can go in and check out books. You can use their computers, use Wi-Fi, print or fax. I know a lot of people also go to the library to get tutored. They have programs for the younger kids in the summer, like arts and crafts and anything just to get them involved. Likes and dislikes of the school. Lytton's honestly known for their dominance in sports, so some parents are really happy and that's why they want their kids to go here, and there's other parents who don't like that. Lytton has done a good job of getting several new clubs started for students who don't participate in sporting activities, so that is an upside. Dislikes, I talked to some people from Lytton, and they dislike that Lytton doesn't really have any opportunities for dual credits. I know town's 15 minutes away. They have seniors who will graduate with an associate's degree, and we don't have that opportunity here at Lytton. They do have some AP classes that we can take here in town, but not a lot of people are able to get tested out of those for college. Lytton actually has a program now for beauticians for college. They just started that a couple years ago, so you can actually get a college degree here in Lytton too for beauticians and barbers. Healthcare. We have several healthcare services here in Lytton. Our biggest one being the hospital. We have my clinics, the Greene County Clinic, a Fast Health. We have 5 dentists. We also have a Hickory and a Hamilton Center for those with substance abuse and mental health disorders. We also have 3 eye doctors. The Greene County Health Department is located in Bloomfield, which is only about 15 minutes away. Alternative health services. Lytton's super fortunate to be in the center of a lot of different places. We can go to a clinic about 15 minutes away in Bloomfield, Worthington, Jasonville. And then if we aren't able to get to our hospital in Lytton, we're also lucky to have several surrounding hospitals about 45 minutes away. We can make it to Terre Haute, we can make it to Bloomington or Vincennes, all in about the same amount of time. Medically underserved population. Medically underserved population here in town, I would say a lot of them have dental issues, whether they have rotting teeth or they're missing several teeth. I'd say that's a big one. Another one is those respiratory issues I was talking about earlier. You see a lot of people with asthma who are breathing heavy. You can hear them wheeze. A lot of people have COPD. You'll see them carrying their oxygen tanks. Like I said, with those medically underserved, you can tell that their equipment's super old and they probably need to upgrade it, whether it's an oxygen tank or their cane and walkers. Likes and dislikes of healthcare services. A lot of people like the clinics here in town because there's one specific that you don't have to have an appointment to go see, like a nurse practitioner. So people think that's very convenient and they like it. Dislikes, there are some people who don't like our hospital because they say, they didn't do anything for my knees. When in all reality, Greene County General Hospital is a rural general medical and surgical facility, so there's often times we have to send people out because we don't have the adequate resources that they need. So people don't understand it. We like to call ourselves a Band-Aid hospital. Another dislike, some people have to sit and wait for their appointments, or they have to wait and they feel like they waited forever before they get transferred out of the hospital. Just people don't like wait times, and unfortunately in healthcare you get those whether you're at the clinic or at the hospital. And a lot of those transportation problems at the hospital came after COVID. Safety, the overall feel of Linton is connectedness. This can be a good thing, and it can also be a bad thing in a small town. Sometimes it feels like everyone knows your business and you hate it, you don't want it. But other times, in times of need, you're thankful to have that connectedness and support of the community. Police presence. We have a lot of police that are always out in town. They patrol. We also have our own police force at the hospital, which they patrol, they do rounds inside and outside of the building. If there's a big event coming up in the town park, then we'll have police there. Common crimes. They're typically the white-collar crimes. Typically around Linton, it can consist of stealing, burglary, motor vehicle theft, property damage, drug possession, DUIs, and unfortunately there are some domestic violence cases. Fire protection, we have smoke detectors, typically in the houses. Unfortunately, not everyone has the money or the resources to get the smoke detectors. Transportation options. Unfortunately, Linton doesn't have any big modes of transportation for the public. We don't have Uber, we don't have Lyft, no bus services. So unfortunately, if you don't know someone and you can't get there on your own, then sometimes people just can't get to where they need to go. At the hospital, there's a program that social services work with the patient if they aren't able to get home and they fit proper criteria, then they can get home that way. But that doesn't happen for everybody, and you really have to work with social services on that. Accessibility for physical disabilities is poor. Our sidewalks in Linton are not good. It's honestly easier to walk on the road, which isn't always the safest. So it's really hard for people in wheelchairs or the electric scooters to get around. A lot of our businesses are first floor, so we don't have a ton of wheelchair ramps, but there are a few businesses that do have those. But another thing I've noticed is not a lot of, businesses, restaurants, a lot of them don't have handicap buttons. So even if a wheelchair or a scooter is able to get up to the door, it's a lot harder for them to get in because there's not a way to keep the door open. Conditions of roadway. It depends, just like I said with the houses, it depends on what area of town you're in. We do have some roads that are fine and recently paved. Others, you would think it's been 15 years since they've been patched. They get really big potholes in them. We even do have some gravel roads here in town. We don't have bike lanes on our roads, and there are a few crosswalks on our roads, but they're hard to see. They don't get repainted often. We do have some street lights where you can press the button so you can walk or stop. Community's perception of crime and safety. A majority of the people that I talk to feel safe in Linton. They just know to lock their doors at night, make sure their purse isn't in their car, lock their car. But overall, they do feel safe. They don't feel like they're going to get mugged for the most part. They're not scared to walk out of a restaurant by themselves. Social. A lot of people go to the bowling alley from young to old. We have bowling leagues, so that's a nice place for different ages to gather. We also have the park, restaurant, and bars. not a lot of places for kids to hang out. I know when I was in high school, after Friday night football games, we'd go hang out at our Taco Bell. There's a little bounce house place for the younger children to go with their family. Adults typically go to the bars and restaurants or clubs like the VFW and the Moose. Otherwise, people typically just cruise around town, or they get together at a specific person's house. People similarities and differences. There is very minimal diversity here in Linton. 90% of Linton's population is white, non-Hispanic. The differences you see depends where you go. If you go to the Moose, it's typically the older population. And then if you go to the bowling alley on a Friday night, you typically see adolescents. But I mean, you can go from seeing young, unhealthy people, or you can go and see, wealthy young people who are taking good care of their physical health. Social aspects. Health of the community. The overall health of our community is poor. Like I was saying, we have air pollution in those coal mines a lot of people work at. So a lot of the times people have COPD, asthma, just respiratory issues in general. And a lot of the people here don't like to take care of themselves. They don't go to the doctor for whatever reason. Or, maybe they can't afford it. Social aspects. The people I interviewed said that Linton doesn't have large industry, and we need that, and that could improve our overall social economic status. It could provide more jobs for our community, which could help our unemployment rate. Greatest community need? We need better sidewalks and more sidewalks for our town. Like I was saying earlier, they're in poor condition, and people in wheelchairs can't use them. They have to use their wheelchair in the road, which is very unsafe. I actually heard a story of someone was on an electric scooter because they couldn't walk, and they were driving in the road because there was no sidewalk, and their wheelchair got stuck on the railroad tracks. Thankfully, they got off, but if we had better sidewalks and sidewalks in general, then that eliminates a problem there. That could have been a lot worse. LHI, injury deaths. These injuries can be unintentional or intentional, mostly unintentional, and it could be a vehicle striking a pedestrian. I mean, that's really easy to do if it's dark out and someone's walking because there's no sidewalks, or there's such poor sidewalks that they get hit by a vehicle, unfortunately. Objectives, walking for transportation. You do see quite a few people walk in Linton, and typically they're not walking on the sidewalk because there's either not one or it's just in poor condition. Conclusion, a way we could get this done is we could speak with the mayor and tell him, how poor our sidewalks are and that we need more sidewalks for the community's safety. And I could also get a petition started. That way we can address the issue as public. We can get that started on social media for those who do have social media, and we can put paper copies up in businesses so that those without social media can also put their 2 cents in and show our community that we really need new sidewalks. And this is my reference. Thank you.